Sundry.
Senator, thank you, Madam Speaker. Madam Speaker, I rise today to make this motion, and it's an interesting motion that I want to name after a constituent of mine who brought it to my attention, who I introduced today, Chris Weiss. Chris is the example that I'm going to use in why I'm bringing this motion forward. This motion is just to ask this government to establish a working group to review whether the decisions made by Alberta Healthcare Insurance Plan or the Out-of-Country Health Services Committee are ensuring that there's adequate coverage for Albertans for their legitimate, and I want to emphasize that, their legitimate out-of-province health care. Madam Speaker, Chris Weiss is an example I think that many members in this House have very similar examples of, where she had to go outside a province to receive health care for a severe back injury, and she was denied reimbursement out of our out-of-country health care insurance. So the premise of the motion is just to review, to make sure that it's doing what we said it's supposed to do. So let me give you an example. Chris Weiss needed back surgery, and it was a very specialized back surgery. And two other people in Alberta had the exact same back surgery, went to the exact same clinic that Chris Weiss did. One was Wendy Finley back in 1999. Another was Melanie, and I can't pronounce her last name, and she's from Cochrane of all places, and she was funded in 2009. So a decade apart, we recognize that these surgeries were necessary. We've recognized, and we now have a history where these people were reimbursed for this very unique surgery. So Chris Weiss comes forward, and she does everything that she's supposed to do. She has to go to this committee to seek reimbursement for this specialized surgery. She's living in pain, and she gets denied. Now, the reason she got denied made no sense to her, because basically they said you should have this done in Alberta. Now, Chris Weiss goes to the AMA, she goes to the College of Physicians and Surgeons, and she does this with the aid of a family doctor, and the AMA and the College of Physicians and Surgeons say, we don't know of any doctor that does this surgery in Alberta. Which makes sense, because we already know of two Albertans who have had to go to this clinic to get the same surgery done. Beyond that, her difficulty going through the maze of dealing with oh, you want me to read my motion in exactly as read? Okay. The motion is as follows. Be it resolved that the Legislative Assembly urge the government to establish a working group to review whether decisions made by the Alberta Healthcare Insurance Plan and the Out-of-Country Health Services Committee are ensuring there is adequate coverage for Albertans in their legitimate out-of-province health care. Now, getting back to the reasons why we need to review this, and that's all we're asking, is to review it for legitimate reasons, that we're not denying people for legitimate reasons. So Chris Weiss was denied, and one of the reasons they were denied, or she was denied, is they said, you need to go to an orthopedic surgeon in Alberta. Well, Chris submitted a list. She went to Dr. Duffy in 2010, an orthopedic surgeon. She went to Dr. Weiss, an orthopedic surgeon, in 2010. She went to a Dr. Story in February 2011, and in 2011 she also went to Dr. Powell, another orthopedic surgeon. She also went to 7 other doctors doing her research. Every doctor said the same thing. We don't do that surgery here in Alberta. Now, Chris went to the same clinic 2 other Albertans had gone to, had the surgery done, paid the money out of her own pocket, and she's much better off for it. She's in no pain anymore. She has approached the review board and went through that process, and their argument is illogical. They're telling her that she should go have it done in this province. So she has asked this board then, what doctor does this in this province? And they told her, and this is the part that's frustrating, they told her because of privacy information, we can't tell you what doctor does this type of surgery. And that doesn't make sense. That's not even logical. So here is a person who has done everything she's supposed to do. And on top of that, she approaches the minister's office and she writes the minister, and the minister's office actually responded to her. Thank you very much, minister's office. But what's shocking about it is when she contacted the minister's office today, they said they have no record of her interaction with the minister's office. How can that be? How can that be? So what we want, and all that we want, is to make sure we're doing what we said we were going to do. We're not asking for anything more. We're asking for legitimate cases that do qualify to be properly reimbursed, to be properly approved. That's all this motion is asking for. So in order to get there, what we're asking this government to do is strike this working group and review this to make sure that these types of cases that many of my fellow colleagues here have experienced in your own constituencies. What we want to make sure is that the government rules and the government regulations are followed so people who are entitled to have these costs reimbursed get that reimbursement as is given to them by this regulation, these rules under our system. So we're not asking for any changes. We're not asking for any special favors. What we're asking for is for this minister, for this government, to review this process with a working group and make sure that it is actually properly running the way it's supposed to. We have far too many cases now that have popped up that have, quite honestly, served as an embarrassment. These are huge cases that have directly affected the health and well-being of people who are entitled to have their costs reimbursed, who have sought this medical care to relieve their pain and suffering. That's all they've done. That's all that Chris Weiss has done. Is she needed this back surgery, which is a highly specialized back surgery that could not be performed in this province, that the doctor she went to said, we do not perform that type of surgery, that is highly specialized, and yet she runs into this bureaucratic circle that says, you have to have it done in this province. She goes to the doctors and they said, but we don't do it in this province. She goes back to the appeals process. They said, well, you should have it done in this province. It's a who's on first. But the problem is it's not a joke. It is the suffering of an individual who is doing the best they can to follow the processes that this government set up. And they're faced with the illogical argument. And her last go-around was told, well, take it to your MLA. That should never happen in this process. It should go right to the committee. It should fit in the rules that the committee has set up. And as long as it fits in the parameters that this government has set in place, then it should be approved. But you cannot put in place a set of parameters and then just lock people into this vicious circle of a bureaucratic maze that just sends them around and around and around with no solution. That's wrong and that's unjust. So bringing this motion forward, what I am hoping is two things. One, that this government actually does it. It strikes a working group to look into this matter, and that this working group will report back to the minister. And if changes need to be made, we make those changes. But I will tell you there will be some examples given by my own caucus members where we can document individual cases where people are being denied their reimbursement and it's a just reimbursement. Again, I want to make a specific point of this. We're not asking for anything, I'm not asking for anything that is not a legitimate reimbursement issue. So we're not going outside any existing parameters. What we're saying is that the people who are being qualified, and we have an example right here, who are qualified for that reimbursement are being denied for illogical reasons that do not make sense. Now, in Chris's case, what is very fortunate is she kept all her documentation, she kept all her letters, and she kept all the responses. And the responses, actually, one of her doctors actually went to her defense with the review panel And I'll give you one last example. And one of the members mentioned it. I think the members of seniors did it earlier. Talked about the Ombudsman's office.
Thank you, honourable member.